my name is India, and I'm going to be your nurse practitioner today. I'm going to go ahead and provide privacy and do my hand hygiene. Can you tell me your name and date of birth?
Alexia, 3/3/2000.
Can you tell me the day and year?
Tuesday, 2026.
And can you tell me why you're here today?
A checkup.
Are you currently in any pain?
No.
Okay, a patient appears to be alert and oriented ×3 with a normal posture, clear speech, well nourished and well groomed, appropriate mood and affect. The text got your vital signs outside, so I'm going to go ahead and go over those with you. Blood pressure 120/82, heart rate 73, respirations 18, 98.2 temp, and 100 oxygen saturation. All of those are within normal limits, so we're going to go ahead and start our assessment. I can tell upon inspection that the color is normal for ethnicity. You are warm, dry, and intact. No lesions, no bruises. Skin turgor is with immediate recoil. Cap refill is less than 2. Radial pulses are +2 equal bilaterally. Brachial pulses are +2 equal bilaterally. The face appears to be symmetric with no deformities noted. We're going to go ahead and palpate the scalp, checking for any lesions, any masses, any scaling, any hair loss. Hair is evenly distributed with no tenderness noted throughout the scalp. Temporal pulses are +2 equally bilaterally. Lymph nodes, preauricular, postauricular, and occipital are all normal in size, small, movable, and non-tender. Carotid pulses +2 equal bilaterally. And I'm going to check for bruise. None are noted. So now I'm going to move to the face. I'm going to palpate the maxillary sinuses and frontal sinuses. Can you tell me if you feel any pain or tenderness in this area?
I don't.
Okay, the eyes are without redness, conjunctiva pink, sclera is white, corneas are clear, and irises are intact with no drainage coming from the eyes. I'm going to go ahead and use my pen light and assess for perla. Can you look straight ahead at me? Pupils are equal round and reactive to light and accommodation. Can you follow my pen? And now I'm going to test the 6 cardinal gaze for extraocular movements. None noted. Now I'm going to dim the light and use my ophthalmoscope to assess the red reflexes, checking for optic disc, retinal vessels, and macula, and all of those are intact and normal. Now I would assess the cranial nerve 2. If I had my Stellan chart, you would stand 20 feet away, read the lines, and I will note your visual acuity based off of that, how you read the chart. Ms. Alexia, can you go ahead and I'm going to test for sensation using my light sensation. Can you tell me if you feel it?
Yes. Yes. Yes.
Okay, perfect. And now I'm going to test for cranial nerve 5. That was cranial nerve 5. Now I'm going to test for cranial nerve 7. Can you smile? Can you frown? Can you puff your cheeks out? Can you close your eyes tightly? Okay, can you stick your tongue out and move it side to side? Okay, cranial nerve 7 and 12 are intact. And I'm going to test for TMJ. Can you clench your jaws? Okay. And now I'm going to assess the nose, which appears to be symmetric and aligned with no trauma. Can you? Okay. Nasal passages are patent. Can you go ahead and close your eyes? I'm going to test cranial nerve 1. Identify the smell.
Vanilla.
Okay. And can you look up? Nasal mucosa is pink and moist with no drainage noted. The mouth is The lips are pink and moist. Can you say ah? Tongue is midline, no deviation. Uvula is midline, no deviation. Tonsils are without enlargement, about +2 with no redness or exudate. Teeth are intact. Gums are without bleeding or edema. Buccal mucosa is pink and moist, and the hard and soft palate is symmetric and intact. Now I'm going to move to the ears, and I will take my otoscope and I would visualize the tympanic membrane, which should be pearly gray with no bulging, no redness. The ears are free of any edema or drainage, no tenderness noted. They are aligned and symmetrical. And now, Miss Alexia, I am going to test your hearing. If you could cover one ear and repeat after me.
1, 2, 3.
Okay, hearing is intact. I'm going to take my tuning fork for the Weber test. I'm going to strike it and place it at the base of the forehead. Hearing is equal in both ears, the same. And now I'm going to strike my tuning fork, testing for the Ryan's test. I'm going to place it behind the mastoid process, move it towards the ear canal, testing for air and bone conduction, air versus bone conduction. Ryan test is positive. Now I'm going to go ahead and assess the neck. Checking the carotid pulses one at a time. They are +2 equal bilaterally. I'm going to go ahead and listen for any bruits. None are noted. Trachea appears to be midline with no deviation. Can you swallow? I'm going to check my cervical lymph nodes while I'm here. Do you feel any tenderness in this area?
No.
Okay. Now I'm going to check the thyroid gland. I'm going to assess it from the back. Okay. No enlargement noted. No masses noted. No tenderness in that area. Now, Miss Alexia, I'm going to get you to turn that way, so I'm going to assess the back. The spine, let me know if you feel any pain or tenderness.
No.
The spine is midline with no curvature noted, no signs of kyphosis or kyphosis or scoliosis. Let me know if you feel any pain or tenderness.
No.
Resonance heard throughout. Okay, and can you say 99?
99.
Checking for
99.
tactile premises.
99. 99.
And it's equal bilaterally.
99.
I'm gonna check your lung sounds. Deep breaths. Breath sounds are clear in all lung fields. No adventitious breath sounds are heard. Can you say E, 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 E? Endoscopy is negative. Now I want to check for CBA tenderness. Can you tell me if you feel any pain or tenderness?
No.
Okay, Miss Alexia, I'm going to go ahead and turn around. I'm going to check your lung sounds anteriorly. Deep breaths in and out. Okay, they are clear throughout. No adventitious breath sounds are heard. Now I'm going to palpate the cardiac regions. Can you feel if you feel any pain or tenderness?
I don't.
PMI is located at the 5th intercostal space. I don't see any heaves or lifts, no accessory muscle use. AP diameter is less than transverse diameter, no barrel chest noted. Color is normal for ethnicity, no lesions noted. I'm going to go ahead and listen at the 5 cardiac regions. S1 and S2 sounds are heard, no extra heart sounds. Want to listen with the bell at the fifth intercostal space, checking for any groups. None are noted. I'm going to go ahead and percuss the borders of the heart. Can you tell me if you feel any pain or tenderness?
No.
No. Okay. And now you can go ahead and okay. Now go ahead and extend your arms up, back, chest is a range of motion without any limitations. Muscle strength, 5'5". Now I'm going to test sensation in the extremities. Can you tell me if you feel sharp or dull?
Sharp. Dull. Sharp. Dull.
Okay. No clubbing, no nail beds or pink. Okay. So now, Miss Alexia, you can go ahead and lay down. I am going to assess the abdomen. If you could lower your hands just a little. Okay. I'm going to auscultate your bowel sounds in all 4 quadrants. Bowel sounds are normal active in all 4 quadrants. Now I'm going to check for splenomegaly. Can you go ahead and breathe in and out? No splenomegaly noted. Liver enlargement. Can you breathe in and out? No liver enlargement noted. Also, I'm going to check for Murphy sign. Can you breathe in and out? Feel any pain in that quadrant?
No.
Okay, Murphy sign is negative. McBurney's point, do you feel any pain in this area?
No.
Okay, I want to do light palpation. Do you feel any pain or tenderness?
No.
I'm going to go with deep palpation, checking for organ. Any masses, any pain?
No.
Rebound tenderness over here. Can you let me know if you feel any pain upon release?
No.
Okay. Now, Miss Alexia, I am going to percuss the 9 regions. Let me know if you feel any pain or tenderness.
No.
Okay. Tiffany heard throughout with dullness in the other areas. Now I'm going to listen for any friction moves or any hums of the spleen and liver. None are noted. The abdomen is flat, non-distended. Umbilicus is midline, and color is normal for ethnicity. No bruise is noted. And now I am going to test the psoas sign. Can you lift your leg towards resistance and let me know if you feel any pain in your abdomen?
No.
Okay, psoas sign is negative. Obturator sign, same. Do you feel any pain or tenderness in your abdomen?
No.
No. Okay, now I'm going to assess the lower extremities, and I can see that they are warm, dry, and intact with no lesions noted, no varicose veins, no adrenal insufficiency noted. Dorsal pedal pulses are +2 equal bilaterally. Posterior tibial pulses +2 equal bilaterally. Popliteal pulses are +2 equal bilaterally. No pigmentedema noted. And I will also check the femoral artery, which is in the groin area. Can you pull back, dorsiflexion, plantar flexion, pushing forward? Can you wiggle your ankles around? Okay. Now, Miss Alexia, you can go ahead and sit back up. am going to first assess your deep tendon reflexes, starting with the brachial, bicep, tricep, patellar, Achilles, and now I'm going to test for tingle sign. Let me know if you feel any numbness or tingling.
No.
Okay, tingle sign negative, Phelan sign. You feel any numbness or tingling?
No.
Phelan sign is negative. Now I'm going to test for coordination. If you could touch your nose and then touch my finger again. Okay, rapid hand movement, coordination is intact. Can you do your knee to your shin? Other one. Okay, perfect. And now I'm going to ask you to sit up just a little. Okay, and now can you go ahead and stand? Can you hold your arms out, do your knee bend, spread your legs, bend. Balance is appropriate with no difficulty. Can you walk normally that way? Okay. Walk back, normal gait. Walk back on your toes. Walk that way on your heels. And foot in front of the other. Okay, balance is coordinated. And now I'm going to test the Romberg sign. If you could push your hands to your side and close your eyes. Okay, Romberg is negative. Patient maintains balance with eyes open and closed. Now, Miss Alexia, you can go ahead and sit back down. No, stand up, I'm sorry. I'm going to test for your range of motion with your spine. Bend down and touch your toes. Side, side, no, all the way to the side. Okay, all the way to the side. And back. Okay, spinal is aligned with no curvature noted. And range of motion is full with no pain. Now, Ms. Alexia, you can go ahead and sit down. Ms. Alexia, now I'm going to assess your coronary reflex, light reflex that I forgot to assess in the beginning. If you could look straight ahead at me, straight at my nose. Okay, and that's equal bilaterally. Also, can you go ahead and lay down so I can listen to your vascular sounds? Aorta, renal, ischium, and the femoral will be in the groin area, and I don't hear no vascular sounds are noted. You can go ahead and sit back for me. And that completes our assessment today.